Hi Kayla, I'm Jan. Nice to meet you.
Hi Jan, nice to meet you too. So the reason why I came in today, Jan, is because my sister and I, Natalie, are going to be moving out together this summer, and I wanted to be able to help her with her dialysis treatments. My parents usually helped her with everything, so I really don't know much about it at all, and I just have a couple questions, so I was hoping we could sit down and chat today for a little while.
I'm very glad that you came, Kayla, to help out your sister. It's very helpful when we have as many family members as possible involved to offer support.
Thanks, Jan. I'm really excited to help my sister because I know she'll love to have a dialysis partner. So one of my first questions is, I noticed that everything that comes in the mail is packaged and sterilized, and so I was just wondering, do we have to be careful not to contaminate all this stuff?
I'm glad you asked that. There are some important parts of the equipment that do need to be kept sterile, and sterile means that there's no bacteria there. And we can't really ever be sterile in our environment because there is bacteria everywhere, even on our body. So the important parts are the end of her transfer set. There's a cap here that covers the end. You never want to touch this end. If you did accidentally touch it or drop it, you want to call us as soon as possible. Put a new cap on it, and we'll make arrangements for you to get a new transfer set to replace that, so you don't get any bacteria inside of your sister. Other parts that are important to keep sterile are things like the mini caps. That's this cap that goes on the end. Make sure you're not touching the inside of that cap. That keeps it, again, sterile. Her dialysis supplies also have sterile parts. So her bags, the part that connects to her transfer set, has a little cap on the end protecting it and keeping it free of bacteria. So again, if you pull this off and you accidentally touch that, it's always better just to throw this bag out.
Wow, I really didn't know that we couldn't touch all that stuff. I'm glad you told me. I really want to help keep my sister safe. So sometimes I notice that my sister gets really frustrated because the fluid's not coming out of the tubes like it's supposed to. So do you have any tips that you could give us to make sure that it's flowing properly?
Well, I know that's very frustrating when you're doing your dialysis and the fluid's not going in and out like it should. So the number one reason is actually constipation. And so I would talk to your sister and ask her if that is a problem. And I know it's kind of a delicate thing to be talking about, but it actually is the number one problem. Most of our patients take a stool softener every day to help with that. If it's not that, and she says that's not a problem, I would always look for physical obstructions. Make sure that those are not the problem. Always look at her catheter. Make sure that there's no kinks. Make sure she doesn't have it taped up in a way that's causing it to kink. Any little amount of kinking actually can obstruct the flow in and out. So always follow with your eyes and probably with your hands straight from her abdomen all the way down and extending through to the dialysis fluid where it's coming from. Make sure that there's no clamps that are accidentally still in place and not open, meaning possibly as well as this transfer set clamp. If that's not open, that can restrict flow. So make sure that everything is open that should be open. And Natalie can help you know what should be open. Another thing that can happen is what we call fibrins. Those can actually be formed by a person's body, and basically it's just a clot that's formed inside their peritoneum. And sometimes those can come through the catheter, and if they're large enough, they can obstruct the line. So if you ever see any little white flakes or any kind of little white pieces of things in the dialysis fluid or in the lines, you want to give us a call, because we can have the doctor prescribe a medication that will help with this and instruct you on how it is used.
One time I noticed that my sister's fluid looked kind of weird. It wasn't clear like the other bags. Is this bad?
Kayla, I'm glad you asked that question. This is a paper that we hand out to our patients to help them determine if their fluid is cloudy or if it's clear, if it's something they need to worry about. But you really can just use anything that has some printing on it, like a newspaper or magazine. This is an example of what it should look like. This is clear fluid, and you can clearly see, obviously, through the fluid and read the print below. Now, it doesn't have to be clear like this where it doesn't have any color. It can also be different shades of yellow and be just fine. It can be a pale yellow or even dark yellow. As long as you can see through it and it's clear, then you don't have peritonitis. This is an example of what would happen if there's a little bit of blood in your effluent or your fluid that you drain off. And this is really common for young women, especially during their menstrual cycle, to see this. And it can be kind of alarming, but don't be worried. A couple of drops of blood can make it look very red. If it persists after the period, please give us a call. Or if you see it when you're not having your period, definitely give us a call. This is an example of the fluid that would be something to be concerned about. This is peritonitis. As you can see, the paper is behind the fluid and you can't see through it. It definitely looks kind of cloudy, and you can see it's a little bit yellow, but it is something to be concerned about. If you do see this, you want to call your peritoneal dialysis nurse right away. Do not wait for the next dialysis exchange. Do not wait for the morning. You want to call that on-call nurse, or if it's during the day, you call to the dialysis unit and report. You want to bring this dialysis drain bag with you to the dialysis unit. If you are directed to the hospital, you also want to bring this with you. So make sure you cap off this bag, cap off you, and come in as quickly as you can to either the hospital or the dialysis unit.
I'm glad you told me this, Jan. Peritonitis sounds really dangerous. Natalie and I will make sure to let you know the next time her fluid doesn't look right. One time my sister's tubing came apart and fluid leaked everywhere. Natalie freaked out and didn't know what to do. It was such a mess. What can we do next time to make sure that we can avoid this chaotic situation?
I'm glad you brought that up. That is an important thing that we really need to talk about. That does happen from time to time, although we never really want that to happen. But if the transfer set gets tugged on hard enough, it can come apart. So any time that happens, you want to clamp off as close as you can possibly to the body. So clamp off that catheter with a clamp right away, and then give us a call. Also, Kayla, what can happen, although it is, again, very rare, is that you can have leaking of fluid around the catheter itself from inside. Most of the time this occurs right after the catheter has been placed, so it's because the person hasn't completely healed yet. So Natalie probably is out of that window of time where that would be a concern for her. But if it ever does happen, definitely you want to give us a call.
I'm glad we know what to do next time that happens, because we definitely don't want to clean up that mess again. My sister seems to get sick a lot more now that she's doing dialysis. One night she just kept complaining how bad her stomach hurt, and it just made me so nervous. What are some signs and symptoms that I should be aware of and Natalie should be aware of, and what is dangerous?
Well, I always want you and Natalie both to think immediately, could this be peritonitis? So if she has an abdominal pain going on at all, or a fever, or any flu-like symptoms where she feels nauseated or is vomiting, or just even has a high temperature, I always want you to look at that dialysis bag like we reviewed before. Make sure that you can see through the fluid that's coming out of her body, the effluent, to make sure that it is clear and that there's no chance that it is peritonitis. After you clear that up and you're sure that it's not peritonitis, treat whatever it is with some Tylenol or whatever needs to be to take care of that sickness. It might just be a virus, but I always want you to think ahead of time. I want to rule out that it's not peritonitis. And if you do find cloudy fluid, as we said before, you want to call a PD nurse right away.
That's all really good to know, and unfortunately it looks like we have to look out for peritonitis in more than one place. I remember Natalie saying that her exit site was sore a couple days ago, and she thought it was maybe because she tugged on it when she was getting dressed one morning. Should we be concerned about this?
Kayla, time to time, those catheters can be tugged on, and we actually tell our patients to please tape up that catheter or wear a belt to help restrict that from happening. If the catheter gets tugged on repeatedly or hard enough, it actually can cause some damage at that exit site or internally and possibly lead to infection. As far as exit sites go, Natalie knows that every day she should be doing daily exit site care, and that involves washing with soap and water, drying well, and using gentamicin cream as well daily. She also should be looking at that exit site and trying to look and see if there's any redness, any swelling, any type of oozing from that site. If there is ever any signs or symptoms that there possibly could be infection, she should call us right away and not wait till it gets too bad. In fact, Kayla, if you'd like, we could go over exit site care now so that you can help your sister if she's ever too sick to do this care for herself. Okay, Kayla, this is how you do exit site care. You want to get a 2x2 wet, or this is something Natalie could really do in the shower with a really clean washcloth, making sure she cleans her site first before she cleans the rest of her body. But wet down whatever you're going to use. Use antibacterial pump soap. It doesn't matter the brand, just make sure it's antibacterial. And get that soap on your 2x2. Then you always want to clean in a circular fashion, starting from the inside, right next to the catheter, to the outside. And you kind of do in big, small circles, increasing to bigger circles. And you never, after you get on the outside, want to go back in towards that exit site, because then we're bringing bacteria in towards the catheter and towards that exit site. After you wash with the soap and the 2x2, you want to rinse it really well. That soap can irritate the skin. So again, either that washcloth that's been dampened or a 2x2 just with water. And again, inside in a circular fashion, increasing your circles and then moving to the outside. And again, I'm never going back in after I've been on the outside, farther away from that peritoneal dialysis catheter exit site. After that's done, you can, after your shower, get a clean towel and blot, or you can get a 2x2. Take that 2x2 again, blotting from the inside to the outside. And again, you can go in a circular manner. But you want to make sure that exit site is nice and dry before you put on any kind of a bandage or any kind of a dressing on that site. And the other thing that you want to make sure is that it's dry before you put on your gentamicin cream. Now for your gentamicin cream, you just need a very small amount, just a little tiny pea-size amount on the end of a Q-tip or any kind of other cotton swab. You want to put that just around that exit site, just barely around that catheter, and then make sure that you get really well underneath that catheter. Okay? And that's it for exit site care. Now it's up to Natalie. If she wants, she can wear a 2x2 over that site every day, and then she just put a 2x2 over the top and maybe tape it in place if she'd like, and that's just her prerogative if she'd like to. But one of the things that we do talk about and stress the importance of is making sure that that catheter is secure, so it doesn't get tugged on like you were talking about. What we recommend is taking some tape, making sure that you hug that catheter really well, and make sure that there's some give in the catheter, that's not tugging just because you're taping it here. We don't want to cause any kind of tugging on that catheter with the tape. So hug around that catheter. That'll help so that it's not going to move. Take another piece, and you're going to come underneath, and this is just a piece I've cut in half. Do a little crisscross over the top, if you can see how I did that. And then the last piece of tape, you're going to come right over the top of both of those other pieces of tape. And again, hugging that catheter, making sure that we're getting really tight there. And what will happen then is, if that does accidentally get tugged, it's going to pull from here instead of that exit site, and that'll keep it protected from infection and from any kind of pain or discomfort when she's got this protected this way. One of the other options she has is there's many belts that are available, or she can make her own if she really feels creative or likes to sew. This is one of the kinds that are available out on the marketplace. And this is just something that she can wear around her abdomen. And it has a little place here that can hold the transfer set, and as well it can kind of hold that catheter and keep it in place so that it does not accidentally get pulled. And this just helps prevent infection at the exit site and provides comfort for your sister. This is an example here of what a healthy exit site should look like and what an infected exit site looks like. As you can tell, with a healthy exit site, that skin is really tight around that catheter, and it looks just like your regular skin. There's no redness, there's no swelling. It just looks healthy. Now, if you look at that infected exit site, nothing about it looks good. The opening is much larger than it should be. As you can tell, if you look closely, there is some drainage. It's kind of red, inflamed looking, and definitely swollen. So we don't want you to wait until it gets this bad before you give us a call. Please, at the first sign of it starting to look a little bit off, a little red, or anything coming from the site, anything oozing, please give us a call right away.
So I was painting Natalie's toenails the other night, and I noticed that her ankles and feet were very swollen, and it just looked funny. Does that have anything to do with the fluid that she's putting in her stomach?
Kayla, I'm really glad that you said that. It's one of the things that people don't understand, because they see that PD catheter growing right into their abdomen, is that they think that a catheter goes into the stomach. It actually goes into what we call the peritoneum, which is the cavity that holds your intestines and some of your internal organs, kind of up to and including your stomach, but it is never going inside your stomach, so it's important to know that. But the swelling she's having in her ankles and feet is caused by fluid that she's taking into her body, or probably the sodium that she's taking into her body. These things are usually because she's eating and drinking too much. So she needs to look at what she's been eating the last couple of days. Has she been eating out too many times, or maybe used too much processed foods? It's important to be a really good label reader and looking on your packages. Even if it doesn't taste salty, sometimes it can have a lot of sodium in it as a preservative. As well, you also need to consider her fluid intake. Our rule of thumb here is about 1 liter of fluid, plus whatever she's still putting out in urine a day. And if you need, we can give you a hat to help you collect so that she can figure out what her 24-hour urine amount is, so that she could better estimate what she should be drinking every day. Another thing that she could do to help determine if this is really fluid overload, which is what it sounds like, is look at her weight and blood pressure. If her weight is up, if her blood pressure is up, those tend to be other signs to confirm, along with that swelling in her feet and in her ankles, that this is fluid overload, and she needs to address it. One of the things she can do with her peritoneal dialysis is, instead of using the 1.5% dextrose, which are the yellows, she can use the 2.5% dextrose, the greens, and that will remove more fluid from her body and help balance that out. In the meantime, she probably needs to be careful about those things that she's eating and drinking. If this continues to be a problem, Kayla, have Natalie give us a call. Maybe we need to sit down with her one-on-one and really figure out what's going on so that we can help her.
I'm glad we asked you that. Next time, we'll make sure that she'll use green bags until her blood pressure and weight are back to normal. Natalie said that she should call you guys if she ever has trouble breathing. Why would that happen, and should I maybe just take her to the hospital?
As we just talked about, fluid can collect in her ankles and in her feet when she has fluid overload. Another thing that can happen if she has too much fluid overload in her body is that it can move up and she can collect fluid in her lungs, which can lead to difficulty breathing. If this difficulty breathing is just on exertion, maybe she's run up some stairs or she's exercised too hard and she's having some labored breathing, give us a call. I mean, that's not normal. It should not be happening. Again, it's probably because she has too much fluid on her body, and we need to instruct her and help her take better care of her body and restrict her sodium and her fluid better. However, if this heavy breathing is at rest, if it's something that you're very concerned about and she's very concerned about, please don't hesitate to either take her to the hospital, or if you don't think you can get her there fast enough, call 911.
So I understand now that we need to take Natalie to the hospital if it's an emergency, but if she's just breathing heavily after exertion, I'll make sure that we call you. Well, Jan, I think that answers all of my questions. Do you have anything else that you think that would be important for me to know?
Well, Kayla, I think that we've gone over almost everything that I can think of right now, but I do want you to know that I never want you to hesitate to give either of us a call. Any one of our nurses here would be happy to answer any of the questions that you have. Sometimes the worst problems happen when patients or their caregivers wait too long and think that they can fix it on their own, or maybe they just don't want to bother us. We want to be bothered. Our profession is providing care for you and for your sister, and that is what we do, and that is what we're here for. So please don't hesitate. Give us a call if you have any further questions.
So what's the best way that we can contact a nurse in case we ever have problems like we just talked about?
You know, Kayla, there is a nurse available after hours and on weekends. We do have a nurse that is available on call, and I'll make sure to provide that information for you as far as the phone number to call, so that you can reach somebody if you ever have any concerns or questions. We do like to have those questions be emergencies after hours, and those things that need to be addressed in an urgent fashion versus just the normal things that we can take care of during the working hours.